Alito. That means hello in Choctaw. We're going to continue the discussion on well, it's not the discussion. I'm broadcasting. You're not here. I haven't anticipated all your questions, but we're going to continue with a discussion on culture and how it relates to the treatment milieu. That is the treatment environment. I have to confess that this actually should be a complete separate class because it's detailed enough to justify doing that rather than 2 lectures within a week and whatever else gets infused throughout the rest of the class. On the day that I'm recording this, I was talking to you about Kathy, who was a gang member, and basically the treatment center that I was working with, where the treatment essentially was in the field, in the office, because she was a West Side Crip, and so that was basically okay for her to show up. But the problems of basically dealing with a person that you see on an outpatient basis, where you're basically trying to correct multiple problems, where your training doesn't necessarily assist you with that. So I wanted to begin to show you by basically showing you that there are models that assist with this. Now, as an example, there's a concept out of Freud, out of Western psychology, where he talks about transference and countertransference. And transference is the process in psychoanalysis. So psychoanalysis is strictly out of Freudian framework, where you have a therapist talking with a patient or a client. The process in psychoanalysis or other psychotherapy whereby somebody unconsciously redirects feelings, fears, or emotions onto a new object, often the analyst or therapist. So transference happens from the client to you. And a lot of times it's unconscious. So what they'll project on you, since you're an authority figure and a power figure, they will project onto you the negative experiences that they've had in the past. So, for example, if it's a female client and you're male, then they may project onto you their father, their absent father. They might start developing, if they've been abused by males. One of the things that abused women often do, especially they sense the power dynamic and basically they try to turn it in their favor, often by attempting to sexualize the relationship, and that's essentially a power thing, where if you've been victimized, essentially you want to not be vulnerable and you want to take control. So often one way of taking control is initiating sex and getting it over and getting him orgasm so he's off me. And that this is a complex dynamic where lots of different things can happen where they project onto you. As I talked to you about in the first day with the skinhead, projecting his racial fears on me. And so doing those things to kind of allay that. So transference happens between the client towards the therapist. Countertransference is a process, even though the definition says sometimes occurs in psychoanalytic therapy, it often happens where repressed emotions, fear, hate, love in the therapist are awakened by identification with the appearance, experience, and feelings of the patient. So if somebody's projecting on their bad daddy onto you, and you respond by having feelings and expectations of them and start treating them like they're a bad kid, if you're not aware and not conscious of this. So countertransference is from the practitioner to the client. Now, in this original construct, Freud wasn't dealing with race. Remember, in Western psychology at the time, basically they're saying that that normal people are middle class, upper middle class, white European males. That's normal psychology. Everybody else is not normal in that framework. Women are crazy. They don't even consider minorities. But in his framework, minorities are inferior. So To this day, as I told you, the American Psychological Association does not acknowledge that race exists as having psychological implications. And when I told you about, Samuel Cartwright, you saw a little bit of the history. And when I made reference to Frantz Fanon, you basically saw how you will actually begin to see how we countered with that. But I want to give you an example of how people of color, in fact, black 12-steppers, people in recovery, have responded in treatment. So let's do a thought experiment for a moment. Sometime in your career, it's happened in mine lots of times, you will have to treat and heal your enemy, or someone you hate, fear, despise, or feel disgust in the presence of. Now, everybody has their personal prejudices. Mine are sex offenders, particularly sex offenders of children. So I've had to treat some of those and had to be aware of my feelings and all that kind of stuff. You'll have to deal with your issues with them before or as you are dealing with them. Hopefully before, so you have some idea, but sometimes your feelings will surprise you. Which would you prefer? Best to identify those biases now. So, thought experiment. You've been given the child of your worst enemy to raise. How do you raise them in the way that that enemy would feel best for the child? That is, not to hate you, but could you raise that child in the way that your enemy wanted them to be raised? How would you do that? Now, if you're not a parent, that might be a little stretch for you, but I want you to begin to stretch your imaginations and think about how you would do that. So a couple of years ago, and also last summer, there was the second African American Treatment Summit in the state. The first one was held 5 years ago in Portland. This last one was held in September in Portland. Well, this is a workshop from friends of mine. Olivia Jeffries was director of Project Network, and Project Network was a project staffed mainly by black women, where most of the women in treatment were black women, sometimes with incarceration issues, etc. And this came about, the reason the summit came about is because to this day, and this is still an issue, black people have not been doing well in treatment. And the problem is not that black people can't do treatment. The problem has been, and I have to be blunt here, white 12-steppers who are not following the science. The science says you need to treat the core emotional issues that are an impediment to recovery. If a woman has been sexually abused, then you deal with sexual abuse issues in treatment, particularly if she's been self-medicating, to deal with the pain and shame and trauma of being sexually abused. Does that make sense? Sure. If a woman has been subject to racism and sexual abuse, those issues should be in treatment. And I have to say this, many 12-steppers think that when a woman brings this up, or a person of color brings up the issue of race, which is their primary level of wounding, primary cause of wounding, particularly in Oregon. Oregon is a racist state. People experience racism in this state and in treatment. People of color have been frequently told that they are defocusing. That has happened at that infamous treatment center that I talked about. It has happened at other treatment centers within town. Famously or infamously, I've made this an issue. Ethically, the state has been training for years that racism is a legitimate topic in treatment. We've been training on that, so deal with it. But many treatment centers, and I'm aware of several students and black women who have been referred to long-term residential women's treatment where they were supposed to be in for 3 3 to 6 months, and none of them lasted longer than a month and a half. One of my interns was subject to racial harassment by staff as well as clients and observed 5 black women being discharged after they raised race as an issue, particularly after clients were allowed to racially assault them verbally in group. That treatment agency is lucky I didn't get them to do a federal lawsuit. All right, so do I have to send black women clients from Eugene to Portland? No. Let's not do that. So what are we doing for African American women in treatment and their families? So this is a workshop. And the second slide was, if it's not culturally specific, it's dominant culture. And they cite Covington from 2007. And the idea behind this is that within the OARs, the accommodation for culture is made by the treatment agency, not the client. Sorry if I sound a little angry about that, but that's the reality. If it's not culturally specific, it's dominant culture. And if it's dominant culture, that means it's going to be toxic to people of color who won't feel comfortable about bringing their issues and won't make a complete recovery. So, key staff issues, because in this conference it was a group of practitioners, basically a couple of hundred folks. So, non-African American staff must acknowledge racism and create an atmosphere conducive to discussing social injustice and oppression as part of treatment. That is not defocusing, that the science says it is not defocusing. Just because it's not explicitly talked about in the big book does not mean that is not legitimately, scientifically, and therapeutically part of the treatment milieu. African American staff must recognize the effect racism has had on their lives to avoid impeding on clients' progress. All staff must recognize the power differential in the clinical relationship. They cannot buy into power struggles with clients, and they cannot take things personally. So, for example, just like any behavior, clients might call you racist. Might be legitimate, might be illegitimate. You should know the difference and be able to respond not just with denial, but being able to say, this part is correct. I do have that kind of attitude. This part is not. Here's what you need to focus on. And be able to redirect skillfully. Now, I'm going to give you a partial construct on how to do that out of Black psychological science, which has been around for about 100 years. So, issues that their women walk in the door with. So Olivia and Jeannie basically say alienation, internal and external oppression and hate, that's self-hate. Social disenfranchisement, society basically makes them powerless. Anger, separation from family and kids, they've had their kids taken away. Trauma affecting parent-child relationships, they've had an abusive partner. Intergenerational family-related trauma, so multiple types of trauma inside and outside of the family. Reluctance to identify their partner to the treatment agency, the partner's resistance to involvement with treatment, legal issues, and financial issues. And all those are separate from whatever physical and biopsychosocial addiction issues there might be. So that's what we're dealing with, especially just with, this treatment agency is identifying this as an issue with black women. One can assume and make that assumption that these might play out with other women of color within treatment and some white women who might be involved with people of color in their lives and having to deal with those issues. Perceived racism and stress. Now, it's a truism of the brain that the individual nerve cell, the neuron, cannot tell the difference between a real event and an imagined event. It reacts the same. Because of PTSD, people are hypervigilant. So they might be hyped up on seeing a situation as fearful or toxic when it actually isn't, but they're projecting that it is, and they feel the stress as if it is. So in this particular side, when they're talking about perceived racism and stress, African Americans' disproportionate exposure to environmental stimuli that are sources of acute and chronic stress have grave effects on health outcomes. So it doesn't matter whether it's real or not. If you feel that it's real, that's what you treat. It doesn't matter whether there is or is not racism present. If they perceive that it is, you need to treat them as if it's real because it's real for them. Perceived racism may be particularly toxic to psychological and physical health because of how the nervous system reacts to stressful situations. So it doesn't really mean they're not mentally ill, but if they perceive that you're hostile, they will be more stressed. So make it safer for them. Joy DeGruy, this is her old married name, Joy Leary, post-traumatic slave syndrome. Leftover beliefs and behaviors from post-traumatic slave syndrome have created feelings of being second class, never good enough, needing to prove ourselves and work harder. We continue to be re-traumatized by racism. The issues never get addressed. The feelings remain intense, and consequently, we must learn to deal with them differently. 5 aspects of alienation of African Americans due to oppression. This is from Frantz Fanon, who was a black psychiatrist early in the 20th century. 5 aspects of alienation from African Americans: alienation from self, alienation from the significant other, alienation from the general other, alienation from one's culture of origin, especially where there's healing available in that culture of origin that you're alienated from, and alienation from creative social activities that are non-addictive. Common stress responses to racism: anger, hopelessness, paranoia, frustration, anxiety, resentment, helplessness, fear. So whether APA recognizes it or not, these things are real. So, key developmental tasks and issues for African Americans. So, refining healthy identity that transforms societal messages of inferiority, pathology, and deviance based on color, race, and/or culture. Strengthening skills for negotiating bicultural and multiracial environments. Engaging in the struggle against social injustice. Managing and informing experiences of social injustice and societal inconsistencies based on race or color. Developing and implementing parenting skills for instructing children how to survive and negotiate the bicultural, sometimes hostile environment. Now, when I was referring to Kathy, whose mother died and 911 didn't respond, whose high school told her she might as well drop out, one of the developmental tasks that she had to identify and this is basically since I was raised by a black psychiatrist, so Fanon's books and all those other things were accessible to me, and I was able to apply this cultural approach to her successfully. And that is, for example, refining a healthy identity. So she understood that what had happened to her was unjust, and that she could refocus her life and gain a life purpose that would give her life meaning outside of the gang. And even though, no, my ultimate goal is not to work for Colonel Cluck, I can do this, and I can identify specific role models. So I gave her lawyer role models. I gave her historical role models, like specifically I used with her King George III's wife, Charlotte Mecklenburg Strelitz, who was a black woman, mixed race woman who spoke 4 languages, had Mozart compose things to her, supported Bach, is named, had a flower named after her, played multiple instruments, and also ran the country while her husband, who we fought the Revolutionary War against, went crazy from a genetic malady. So She didn't know about that, so I gave her aspects of black history so that she could get role models, and this was legitimately part of treatment and also how you turn gang kids around, using elements of what's now popularly called rites of passage. So racial and personal trauma must be dealt with. It's not what's wrong with me, but what happened to me. Now, when we take this out of a culturally specific context and we apply it to a general population, DSM, when it shows that, gives you a diagnosis and says, if you remember first day when we talked about diagnosis, the idea that only one person knows what the diagnosis means and is usually the practitioner that knows, not the client. So the client has a story. So what happened to them to cause that particular trauma? So oftentimes when we look at the concept of self-medication, people are self-medicating for some kind of trauma. So we look for the obvious things. If you're a woman, ask the question, have you been sexually abused? If you're a person of color, have you experienced racism? Just go right there. You will develop trust in them by talking about it explicitly, even though it doesn't make you comfortable. So, often in the absence of answers from the mainstream, people of color have had to create and rediscover their own systems of healing. So as another example, outside of the black piece, Eduardo Duran, Native American, Western-trained clinical psychologist, articulated the construct of the Native view because the Western view wasn't working with his New Mexico Native clients. And he was finding the therapy that he was taught and trained to do wasn't working with them, wasn't reaching them emotionally. And so he began to develop other constructs that were more indigenous and also blended with Western science. So, and I hit you with a quote of his. In effect, psychology is the enforcement branch of the secularized Judeo-Christian myth. Our discipline has been a co-conspirator in the devastation and control of those who are not subsumed under a white male heterosexual Christian subjectivity, that is, feelings. So if basically Freud and company said that normal human beings are white males, and if you're not a white male, you're not normal, it's Western psychology that has imposed that view of saying in order to be psychologically healthy, you have to think like a white man if you're not white. Well, what about white women? What about other folks? And there are some white men that don't think like Freud did. Freud was a cocaine addict after all. What's normal about that? So Duran wrote in his book, Native American Post-Colonial Psychology. So talking about how psychology was a colonizing discipline. So in the Native view, for example, medicine, the term medicine, it means spiritual energy, a substance, a ceremony, a spirit. So a spirit is basically an independent, conscious, non-physical energy entity with a history, present, and a future. Everything has it. So when you take a substance, a medicine, that alters your consciousness, that substance, that medicine, has a spirit. And that spirit must be acknowledged within this framework, must be acknowledged and reverenced in a humble and prayerful manner. So in other words, you pray to the spirit of the substance you're taking before you take it and give it respect. Now, in this framework, if you don't do that, if you don't acknowledge it, it takes a piece of you, in particular your body, as well as a piece of your soul. And so if you remember first day when I talked about when you do methamphetamine, this is from that view, from Duran, he said if you take methamphetamine, you're not just taking that single dose that's in your body, you're taking the entire process of its manufacture as well as its entire history. So even if you never participated in war, even if you never participated in sexual abuse of children on methamphetamine, the spirit of that substance is being absorbed into you. So whether you lose your teeth or not, basically it'll take a piece of you. So that's another reason for abstaining from that particular substance. So as I said in day one, In this view, you don't just do a dose of the drug, you take into your spirit the entire history of the drug, good or bad. And since meth was created for soldiers in war, to put them in the killing rage, to be able to rape and kill, as a side effect it destroys your teeth and bones. In males, it gives them priapism, which is a painful erection, where they cannot orgasm. The drug makes them incapable of orgasming, so they attempt to have sex with anything, infants and children mostly, but also women in wartime, etc. Hence the stat in Oregon, where a majority of Oregon children are sexually abused by male meth addicts. That's partially driven by the quote-unquote side effects of the drug. But from the native point of view, it's like, well, yes, this is what's been done. That's why you don't want to take this. So this is not to say that meth is the only drug people abuse children on or rape people on. Right? This is an explanation from a particular worldview. And this is also not to say, and Duran would not say, we're throwing out the Western scientific view either, which holds that drugs are just drugs and there's no spirit involved. But other cultures give a framework that's older than 150 years about how you approach powerful psychoactive substances. So within, for example, the native view, it's not just about you, it's about your relationship to the rest of the universe, including healing the past, healing the present, and setting a tone for the future. The substance, any substance, can facilitate that or hinder it depending on how you approach it. But a medicine person is a trained professional who got their training within a system that's older than the university and Western medical system, and trained in the therapeutic use of mind or mood-altering spiritual technologies. Now, a lot of this happened pre-colonial, pre-contact, so a lot of that knowledge had been lost, and many of these people had been destroyed because these were also the people that says, we're not trading our land for fire water, and nobody can use fire water, and these were often targeted by the army and government folks and either incarcerated or killed when they were trying to keep Native Americans from drinking alcohol, when it was illegal for Native Americans to drink alcohol. So native axiochemistry. Powerful psychoactive substances should not be self-administered outside of a ceremonial context, under the guidance of out of the guidance of a trained practitioner. Hence, for example, teepee meetings, which are peyote ceremonies in the Native American church. These gatherings are held to pray for the healing of specific people rather than a group of people getting high together. That's not the intent. They are only getting together for praying for others who may or may not be in the circle. So, I mean, you think about when you sit at dusk to dawn with one water break at midnight, that's not exactly getting high. And you basically have to sit and pray all night. So, within the well-briety movement, this is one technology for alcohol recovery, and obviously is not necessarily accepted within the Western framework, although peyote is federally protected, practiced for Native American church members. Many states recognize that practice. Oregon did not. For a time, Oregon discriminated against Native American practitioners and others who were clean and sober from alcohol, but participated in peyote ceremonies in other states where the practice was allowed. So my friend Al Smith, the peyote case, he is still clean and sober from alcohol. He participated in a peyote meeting while he was employed as a drug counselor on his own time out of state, and he got fired. Now, the other state recognized the use of peyote for Native Americans, and he is a full-blooded Klamath, so it was actually legal for him to do that, but, you know, basically they decided to prosecute him here until they changed the laws to allow a defense for that. This was an example of type 4 or type 6 ism discrimination. These are species of institutional racism. So, in terms of isms, I was driving down the freeway and I basically thought of this acronym as most of the literature on systemic discrimination focuses on racism and sexism. What I decided to do is look at the suffix ism itself, and I basically explained it this way: individual, structural / societal mentality. That is, isms are systems of discrimination based on perceivable human difference. There's a white male writer named Alan Johnson who wrote a book called Power, Privilege, and Difference, and he refers to this as the matrix of domination, this collection of intersecting isms, if you will: classism, racism, ageism, ableism, sexism, heterosexism, etc. Classism as well. So what he says is, we don't have to fear that which we don't understand, but isms set it up structurally so that we do fear that which we don't understand. Now, literature around racism focuses on individual and systemic forms of racism based on discrimination based on perceivable characteristics. So when I talk about this as a body of work, there is a body of work, usually among black psychiatrists, but others have taken up the cause as well. Daryl Wing Sue and microaggressions, and I'll just run this through. I'll run through this so that you have a useful framework to begin to look at working on these issues, because they are legitimate in treatment. So just like culture is more than race and ethnicity, systems of discrimination involve more than race and gender. So they involve class, race, religion, spirituality, addiction, ability, age, sex, heterosexism, homophobia. Now, the basic equation here that was set by the U.S. Commission on Civil Rights is power plus prejudice equals, well, the original literature was racism, but it could be any ism. So it's U.S. Commission on Civil Rights, 1970 definition. So just so you know, not making that up. It actually came from somewhere. So I've identified, the literature identifies several different types of isms, and the only thing that I've done here to make this mine is essentially put all 6 referred to in the literature, not only in the literature on racism, but also case law about, for example, within a racial construct. But these don't just apply to race. There are other, an ism is any organized system of discrimination based on any perceivable human difference. So as we talk about class, somebody rich or poor, middle class, working class, owning class, race, whatever race is, religion, who has a religion, who doesn't, whose spirituality is recognized as a religion, who isn't. These are under race because race determines that Native Americans do not have the same standing as Catholics. Mormons may or may not have the same standing as Protestants. Buddhists, Muslims, Jews, all have varying standards according to being white, Anglo-Saxon, Protestant, right? Addiction, ability, age. Addiction. Whose addiction is treated like a criminal problem? Whose addiction is treated like it's a medical problem? Addiction is always a medical problem, but depending on what your address is, so that means a class analysis, depending on what your skin tone is, which is race analysis, your addiction may or may not be treated the same as someone else. So if you understand, the concept that blends all these different isms together is called intersectionality. So the idea about intersectionality is all these different isms interact. Most of the literature started out focusing on race, so that's why I do that. So in the literature that focused only on race, there are 6 types of isms. Type 1, verbal or physical assault. They call you a name, or they beat you up based on, or they assault you based on certain perceived characteristics. And it's obvious. So these first 2 are caused by individuals. So type 1 and type 2, nonverbal microaggressions. So these two are caused mostly by individuals. Then type 3, unconscious institutional. So institutions are collections of people. And so in type 3, this is an evolutionary stage, the institution is unaware or unconscious of the fact that individuals within it commit type 1 and type 2 and therefore make no policy, do no training, and do nothing to prevent those things from happening. Type 4, conscious institutional, it's where discrimination is in fact legal to do. And the laws support discrimination and the institution actively participates in it. So the state of Oregon was created to bar black American citizens from other states in the United States from coming here. So Oregon was, and sometimes is, well, it's no longer legal, but it was created to legally discriminate until the laws were changed. Nazi Germany, apartheid South Africa, the Jim Crow South are also examples of type 4 conscious institutional. Now, the reason we make this distinction is because even if it becomes illegal, those attitudes don't go away. They still remain and are talked about and acted upon. Type 5, conscious institutional illegal. The discrimination is illegal. There are laws against it, but it continues to happen by institutions because it's still profitable to discriminate. And then you basically have to catch about it, and there has to be rules of evidence to catch them. Type 6, what Frantz Fanon basically coined, the concept of socio-structural violence. This is why in my original ISM definition that society has structures within it that replicates discrimination and hold discrimination as normal. And when Fanon was basically first describing this, he was from French Martinique. He trained he became a doctor at the Sorbonne in Paris, and then was posted at a French colony, Algeria, where he witnessed, as a black psychiatrist, patients with the same diagnosis. The black patients got torture, literally torture, while the white patients got therapy and talk therapy and drugs. So black patients with the same mental illness as the whites got torture and no therapy, no talk therapy, no drugs. Just straight torture, physical torture. And the whites got treatment. And this was normalized. This was in a hospital setting where they're supposed to be coming for healing. So it was normal to do torture of people of color. We're talking about 20th century here. Socio-structural violence.